Welcome to Mid Yorkshire Antenatal Class 3. In this session we will focus on birth planning. So what is positive birth? It's about giving you information to empower you and your partner to create a positive birth experience. It's about challenging negativity and fear around childbirth and giving you choices about how your baby is born and what your journey will be. Firstly, you can start having conversations with your named midwife about your birth plan. This is an opportunity for you to look at your choices, preferences and needs in labour. You can also visit the Tommy's website for further information for making your birth plan. And you can access your birth plan on your maternity app and build this with your named midwife. Birth planning. You can speak to your midwife about your birth plan, and there's also a section on your maternity app where you can make notes, ask questions and communicate what you would like on your birth plan. You might want to think about positions to use while you're in labour, skin to skin, your choices about birth partner, how you want to feed your baby, if you feel particularly strongly about any aspects of pain management, whether you want your baby to have vitamin K injection, and whether you want your baby to have delayed cord clamping. Speak to your community midwife about this birth plan and enter your details on your maternity app.
Your community midwife will offer to create a birth plan with yourself and your birth partner around 36 weeks pregnant. You always have a choice into your preferences for birth, and please note all plans are flexible. Your midwife and healthcare providers will work together with yourself towards achieving a positive birth experience. During the birth planning, your midwife will discuss ways in which to reduce intervention. It is essential we always work as a team. We will work with yourselves to make your birthing experience a positive experience. Current research supports that being upright and active in labour has many advantages for baby, your body, and can increase your satisfaction about the experience. Whichever birthing environment you choose to birth in, please make use of all available equipment. For example, a birthing ball, the chairs, you can even squat on the floor or lay on the floor to deliver baby as well.
Labour positions. Advantages of being upright. A less painful labour, less need for an epidural or pain-killing injection, a slightly shorter labour, improved birth experience, better oxygen supply to your baby, and a higher chance of a normal birth.
So when you're in labour, you might want to change position frequently. If you get tired, it's fine to lay down for a while, or we can prop you up with some pillows or lie you on your side. I know typically that you see women on TV in labour laying flat on their back or semi-recumbent, but this is not really ideal for labour. Sometimes we can use monitoring equipment to monitor baby's heart rate, which can make you feel a little bit more restricted with your movement. But as you can see from these images, these women are being monitored and they can still try lots of different positions to help them move and feel upright and active.
When am I in labour? When to call us? If you think your waters have broken, or if you're unsure that your waters have broken, or you see a mucus plug or a shore, or you see some blood loss, or if you're in pain, or if you start with regular contractions that last at least 60 seconds or every 5 minutes, or you think you're in labour. At any stage, if you think you're unsure and you need some guidance, please feel free to contact our triage, which is a 24/7 number.
Hormones during our labour. Oxytocin and adrenaline are two of the hormones that can help and hinder our labour. Oxytocin is the hormone that allows us to have contractions, make us feel calm, and lets our milk down. If we can create an environment that is calm, makes us feel safe and loved, oxytocin will flow freely, meaning our contractions are stronger and more effective, which can lead to a quicker, more pleasant birth. Adrenaline is the hormone we feel when we feel scared or anxious. If we allow this hormone to become too high, it counteracts the effects of oxytocin. Asking questions, bringing in things from home that make you feel safe, and having a loved one with you can all contribute towards you feeling safe during your labour. Having an understanding of what is going to happen and your expectations can also help to oxytocin to flow so that you feel safe and calm. We do need adrenaline in our labour to help us push our babies out. However, if we have too much adrenaline throughout our labour, this can counteract the oxytocin. There are things you can do at home in early labour to help yourself. Try some of the positions that we talked about. See what feels comfortable for you or seems to help with the labour. Get support from your partner or your mum or a friend, anyone who you know is going to make you feel safe and comfortable. Think about the massages that we talked about in session 2. This can really help to distract you from the pain and help you cope. Think about how each surge or contraction is bringing you a little bit closer to meeting your baby. And monitor any signs of changes in your body so that you can discuss it with the midwives when you call maternity triage. Some people find it useful to have a bath or gently walk around the house and garden to help them manage. Don't forget, we're here 24 hours to give you advice and support. You can never call us too many times. Music. Listening to music can really help to distract you and help you to cope and really help you to relax. So people's musical tastes vary quite widely. Some people like music that makes them feel energised, others like tinkly music that can help them feel relaxed or lift the mood. It's up to you really, but it's useful to make a playlist to bring with you. We know that music can help to reduce anxiety, which in turn is going to help raise your oxytocin levels and help you feel more calm and in control. So don't underestimate what music can do in your labour. Research tells us that it can lower our perception of pain and reduce our need for medication. Low lighting really helps when we're in the throes of labour. We know that it increases our hormone, our oxytocin levels, which help the contractions be more effective. It can help our labour to progress quicker. It definitely helps you to feel more calm and relaxed. And women often say that they felt a little bit more private and the room felt more intimate, which really helps you to feel safe and calm. We offer lots of different things to help you manage pain in your labour. Obviously the things we talked about, like relaxation, massage, using music and lighting, can really help you to manage that. We have access to pools for water births, and like I say, at home you can try getting in the bath as well. We have something called gas and air, which is Entonox. It's very good because it's fast acting and it leaves the body quickly. It helps lots of women cope in labour. If you feel like all those things are not quite enough and you need more support with your pain, we can look at some injections that can help to make you feel relaxed and manage that pain. And if it comes to it and you feel that an epidural is something that you want, we can call the anaesthetist to discuss all the risks and benefits of an epidural and whether it's appropriate for you. If you're worried about any of these pain management techniques, then please talk to your individual named midwife and they can go through them with you. So what if you need help from a doctor? Women are worried about how they can stay in control, and you must remember that you always have a choice about what happens to you and your body. Sometimes babies need continuous monitoring. This is where small electrodes are put on your abdomen and it doesn't harm you or your baby. It does tell us things about how baby is coping with the labour, and then the midwives and doctors can assess what is an appropriate action to take as your labour progresses. You can stay upright and active during this monitoring, and sometimes, if it's appropriate, a small clip can be placed on baby's head to enable you to move around more freely. There are situations where the team of midwives and doctors may advise you that they need to deliver your baby more urgently. This can involve a cup or an instrument placed on your baby's head while it's still in the birth canal to birth your baby faster than your own contractions. You will work with the doctor as a team to push your baby out. You will be told why this is happening and ask for consent to do this. Your midwife will stay with you the whole time to explain everything. In some situations, it's not possible to deliver a baby like this, and it's safer to go to theatre for a caesarean section. This can be scary, and staff are aware that it can be alarming for you. They will explain everything and your birth partner can go with you. Hopefully, if everything's okay, you can have a cuddle with your baby in theatre afterwards. If not, they will explain what is happening and where baby will be going. You must remember that you can ask questions at any time. You are in charge of your own body and your baby, and don't feel silly about asking about something that affects you. If you're having a planned caesarean, you can still make a birth plan. Your partner can use the relaxation and touch before you go into theatre to help you relax and bring you closer to one another. Staff will talk you through what to expect, and your partner can be with you throughout most of the process. It will be a very emotional time in theatre and you can feel quite overwhelmed, but we're used to this and will keep you informed as we go along. You can make choices that will make the process feel more individual to you and more natural. You can ask for the screen to be lowered and your head slightly raised. Some people like to see the baby emerge from their abdomen, others don't. We do delayed cord clamping as routine to give your baby 1/3 more blood and 1,000 more stem cells. And once baby arrives, staff will check them over, and if there are no problems, you can have skin to skin in theatre. Time after birth. This is something really positive you can do for your baby. As new babies have this real strong need to be close to their parents. It helps them to feel secure and loved. It also helps you to build a relationship and develop a bond. The research tells us that skin to skin with either mum, dad, partners, whoever's involved, helps to regulate baby's temperature. As they're sat in a 37-degree incubator at the moment inside your tummy, when they're delivered, the room is around 24 degrees, which feels very cold to a newborn baby. And we know by having skin to skin, it really helps to regulate that temperature better than any of our incubators can do. It also improves baby's immunity, so your baby will pick up the good bacteria from your skin, which will really help to test its immune system and keep it healthy. It releases happy hormones into baby's brain, which makes them feel safe, loved, secure, and it actually helps to build baby's IQ and brain development. It also helps to develop a relationship to get used to your baby's feeding cues. If you're thinking about breastfeeding or bottle feeding, it's good to still have skin to skin. Once you're discharged from hospital, your midwife will come and see you at home regularly. We will give you information about registering your baby's birth and talk about the screening test that we would like to do for you and your baby. Eventually, around day 10, your health visitor will start to take over your care, and you can think about registering your baby with the local GP. For further information on this, see our Trust website or our Discharge from Hospital video.